In 2023, the U.S. Surgeon General declared loneliness a public health crisis, as deadly as smoking 15 cigarettes a day. Yet most people don't realize they're suffering from something far more than just feeling blue. In 2023, the United States Surgeon General Dr. Vivek Murthy released a landmark advisory that sent shockwaves through public health. Loneliness and isolation had become an epidemic, with mortality risks comparable to smoking 15 cigarettes a day. Yet for many, this revelation came as no surprise. They had been living it in crowded cities, in suburban homes, and in digital spaces where connection has become a commodity rather than a birthright. Chronic loneliness is not merely an emotional ache. It is a physiological assault on the human system, a silent rewiring of the brain and body that researchers are only beginning to understand. It is the epidemic nobody talks about, precisely because it thrives in the shadows of shame and invisibility. Since the 1980s, the number of Americans reporting no close confidants has tripled. The COVID-19 pandemic merely accelerated a trend that had been building for decades. But chronic loneliness is distinct from situational loneliness. It is a persistent, subjective feeling of social disconnection that persists even when surrounded by others. It is not about being alone. It is about feeling alone. And the evidence now suggests that this feeling, left untreated, can be as damaging to the body as hypertension, obesity, or a sedentary lifestyle. We have never been more connected technologically and never more isolated socially, a paradox that defines our age and leaves millions feeling invisible. To understand chronic loneliness, we must first distinguish it from solitude. Solitude is chosen. Loneliness is imposed, often by circumstances, but increasingly by the architecture of modern life. Psychologists define loneliness as the discrepancy between one's desired and actual social relationships. When this gap persists for months or years, it becomes chronic, embedding itself into the neural circuitry and endocrine system. This is not a character flaw. It is a biological adaptation gone awry. In evolutionary terms, feeling lonely was a survival signal. It drove humans to seek the safety of the group. But in a world where the group is fragmented, that signal becomes a chronic stressor. Research led by Stephanie Cacioppo at the University of Chicago has revealed that chronic loneliness fundamentally alters brain function. Using functional MRI scans, her team found that lonely individuals show heightened neural activation in response to social threats, a hypervigilance to rejection that paradoxically pushes others away. This creates a self-perpetuating loop. The lonely person expects rejection, perceives it where none exists, and withdraws further, deepening the isolation. Meanwhile, the hypothalamic pituitary adrenal axis remains activated, flooding the body with cortisol. Over time, this dysregulation impairs immune function, increases inflammation, and accelerates cellular aging. The data is sobering. A 2023 meta-analysis in Nature, Human Behavior examined 90 studies involving over 2 million participants and found that social isolation and loneliness increased the risk of premature death by 26% and 29%, respectively. To put this in perspective, loneliness is a greater risk factor for early mortality than air pollution, physical inactivity, or obesity. Yet the numbers only tell part of the story. Young adults aged 16 to 24 report the highest rates of loneliness, far higher than the elderly, who are often assumed to be the most isolated. This counterintuitive finding has reshaped the conversation. Loneliness is not a problem of aging. It is a problem of modern life, one of the most contentious debate centers on social media. A longitudinal study found that adolescents who spent more than 3 hours per day on digital devices were 35% more likely to report loneliness than those who spent less than 1 hour. But causation is difficult to establish. Do lonely people retreat to screens, or do screens make people lonely? The answer appears to be both. Social media offers the illusion of connection without the substance, a dopamine hit without the oxytocin release from genuine interaction. However, for marginalized groups, online communities can be lifelines. The key lies in whether digital interaction supplements or supplants in-person relationships. Chronic loneliness is not merely a psychological state, it is a multisystem disease risk. A landmark study found that loneliness is associated with a 29% increased risk of coronary heart disease and a 32% increased risk of stroke. The mechanism is twofold. loneliness increases blood pressure and promotes chronic inflammation. In a 2015 study, researchers found that lonely individuals showed a distinct pattern of gene expression, what they called conserved transcriptional response to adversity, that suppressed antiviral immune responses while amplifying inflammatory ones. This makes lonely people more susceptible to infections and chronic diseases alike, and the link to cognitive decline and dementia is equally alarming. The good news is that chronic loneliness is not a life sentence. Interventions that target maladaptive social cognitions, like cognitive behavioral therapy, have shown promise in helping individuals break the cycle of hypervigilance and withdrawal. Community-based programs that foster meaningful, in-person connections also offer hope, but perhaps the most powerful antidote is simple awareness, recognizing that loneliness is not a personal failure, but a biological signal that something needs to change. By understanding the science behind this invisible wound, we can begin to heal, not just as individuals, but as a society that values genuine connection over digital noise. If you found this valuable, consider sharing it with someone who might need to hear it, because the first step to healing is knowing you're not alone.